Hi everybody, just to let you know that for today's seminar we're actually going to be filming it. If you're not happy in the chart, you need to kind of move over this side of the room. Mel's at the back of the camera, she's angled it strategically so that we haven't got too many faces. I'm just going to get my shovel. There you are.
Oh, all right. Oh, it's a bit right. So while Sandra gets sorted, I shall introduce, if I need any introduction, but I'll introduce myself anyway. I'm Damon Berridge, statistician from data science. First of all, it's good to see so many people here. Here this seminar by one of my colleagues, Bob Laramee, all the way from the computing department, all across the way. Travel expenses will be too high on this occasion. Bob and I, we've already worked together for the last year or so. I'm going to be mentioning a couple of our masterpieces in Passive Excellence. Today Bob's going to talk about an area in which Bob is world-renowned, important area of data visualization. So without further ado, over to you, Bob.
Thank you very much, Damon, for the great introduction. Thank you for the invitation. It's quite a privilege to come and speak for the School of Medicine. And happy Wednesday, by the way, and happy World Vegan Day as well. So the title of this talk is called Visualization of Public Healthcare Data. But before we jump in, I just have two very quick announcements. We are hosting a conference next year called the Computer Graphics and Visual Computing Conference. It will be in September here at Swansea University. So if you might be interested, let us know. There's a link to that on my webpage, and obviously Google knows about it as well. It might be good for recruiting, like if you're looking for talent, this is a good place to recruit talent. Right, geeky computer scientists into your School of Medicine. We're also working on an EPSRC Doctoral Training Center grant. So probably you've heard of doctoral training centers and doctoral training center grants and so on. This is in conjunction with the College of Engineering, and there is certainly a medical theme involved. So if anybody from the School of Medicine would like to get involved, we would like to have somebody in the School of Medicine on behalf of the School of Medicine to get involved. That would be great. Something to consider, David. Okay, so I'll start with the announcements. First, we're going to talk a little bit about visualization in general. Then we're going to talk a little bit about the healthcare data, and then we're going to talk about the combination of the two. So this is something I think this is a slide that everybody understands, right? Like, why are we here? Kind of, that could be the title of the slide. Why are we here? We're all studying healthcare data in some way, shape, or form, right? And healthcare data brings with it many, many challenges. I just Googled healthcare data and I got this image, which was very, very convenient. It just summarizes some of the challenges, right? Unstructured data, location, data definitions, right? Data formats, data complexity, regulations and requirements. I think everybody in this audience is quite familiar with all those challenges. There is a challenge missing from that slide, which might be the biggest challenge, and that's the size, right? Big healthcare data, right? Trying to understand and derive insight from large quantities of healthcare data. So we're going to focus on kind of two aspects-ish, the size part and the location part in this. So one of the great challenges with healthcare data is coupling the geospace with the healthcare data. So where in the world are these events happening, and where are the services, where are the diagnoses, where are the prevalences, right? We want to couple the geospace to the actual healthcare data, and that's part of what we're going to talk about today. Also, feel free to interrupt me with questions along the way or comments, right? Even if you're worried about the camera. So a little background on data visualization. I'm actually going to ask you to put on your brain caps for just a few minutes during this introduction. So data visualization is using computer graphics to depict reality, or in this case, large healthcare data sets, right? It's very good for exploration, and that's the case when you don't understand your data, you're not an expert, maybe you've just been given some data set and your goal is to understand what it is and what its characteristics are, if there are any patterns, outliers, trends, and so on. It's good for analysis, so that's the case when you are an expert. Maybe you collected the data by yourself. You already know what kind of questions you want to answer or what hypothesis you want to confirm or refute. I think most people think of visualization from presentation, and that's after you've done your exploration and analysis and you want to present the results to a wider audience, right, to make them accessible. Some more subtle aspects of visualization, it's very good for acceleration. So you can find things using data visualization very, very quickly. And sometimes you can find things that are impossible without using visualization. So sometimes you can search and you can accelerate your search from taking months to seconds, right, using data viz. Another more subtle aspect is confidence. So data visualization increases your confidence. When you can see the data and you might have had some suspicions about some behavior that's happening, but finally when you can actually see it, your confidence is increased. You're more confident that what you're doing is actually correct. So introduction to tree maps. This is where you have to start thinking. Has anybody here seen a tree map before? 1, 2, 3. Okay, oh, that's good, that's good. Maybe half the audience. So we're gonna actually get a quick introduction to tree maps now. So if you've never seen them before, now you'll know, you'll be that much more sophisticated after this. So imagine you have hierarchical data. On the left here, that's hierarchical data. Very, very common, right? Can anybody think of a very common source of hierarchical data that you happen to encounter on a daily basis? Budgets? Budget could be an example, yep. I wouldn't say it's the most typical example. Can anybody think of a more typical, like common hierarchical data that you're confronted with daily?
What about biological taxonomy? So, like animals.
Yes. A taxonomy is a great example. Yep.
Ontology. Ontology.
An ontology, yes, yes. A sort of more, let's say, I don't know, the most common example that I can think of is your hard disk on your computer, right? That's a set of data, and you have the root folder, and then you have folders inside of folders, and you keep going until you get down to the files, right? That's a hierarchical data structure, right, that you happen to see every day. So that this depiction on the left is a hierarchical data set, and this on the right is the equivalent tree map. So what happens is the root node, right here at the top, that rectangle, gets translated into the largest rectangle in the tree map. So it reserves the space for the tree map, right? And then it's subdivided, right? And each child of the root node is also represented by a rectangle. So here we have the number 12, right? And that is represented by this rectangle, which is labeled 12, right? Here we have 8, right? And that's represented by this long, thin rectangle, right? And then we have 2 more rectangles, and the series of 2s, 3s, and 1s. So look, this rectangle here is actually here. It's the big one that encloses its 5 children. Can everybody see that? So there are 5 children there. They all have a parent rectangle, and the parent is right here. Right? It's not that easy to see, but hopefully you get the idea. And then we have another rectangle on the right, and that encompasses the rest, right? It encompasses this portion of the tree map, and it gets subdivided, right? The 6, 8, and 11 are here, and those map to this rectangle. And there's the 6, there's the 8, and there's the 11, and then we have 5, right, and then 40. Right. Did everybody follow that? Hopefully, quick introduction to tree maps. There's some tricky stuff going on here, right? Like, how do you place the rectangles in space? How do you lay them out? We're actually not going to talk about that, because it would take too long. But that's the subtle aspect. Is, oh, how do you do that, right? That's what the computer scientists are for. And you can also notice that the size of the rectangle is mapped to some data value. In this case, it's 40. So 40 is big, right? It's a big value. So it occupies the most space in the tree map. That's the other great property. That's a property of tree maps. Here's another example from the 90s. This one's a little bit different because they've added some padding between the rectangles, the parents and the children, so you can more explicitly see the relationship between the parents and the children, right? A162 is at the top. I should be able to reach that. There's A162, it's the root node. Then there's B10, but right, look, there's like a padding around the child node, so you can more explicitly see the relationship between the parent and the child, right, in this example. That's the only way it's different, right? Then there's C30 over there, and then D62, there's D62, right? And then it's subdivided, right, into children, F6, G6, H6. I44 has children, right, so it gets subdivided, right, and it's 5 children, right, and so on. So it's a recursive subdivision. Everybody still with me? Good, good. Any questions about that? Tree maps make sense. At least you can sort of understand what you're seeing, so to speak. Here's an actual example, right? I tried to load an actual example here. This is a program called Disk Inventory, right? It's a tree map of your hard disk. It's for free. Anybody can download it and use it. Maybe you've run out of disk space and you just thought, I wonder where my disk space went. How is that possible? I have 5 petabytes of storage here and it's gone. Like, how is that possible? Well, you can quickly find out where your disk space has been used up with disk inventory X, right? Very, very quickly. Right? Each rectangle here represents either a file or a folder. So the bottom level rectangles represent files. And as I move my mouse around, the actual file, its path and its name appear at the bottom here. Right? So that's looks like a book. That's an audio file, which is an audio book there. Right, and we can sort of see all my audio files got grouped together in this big parent folder, right? And these are a bunch of more audio files. So I guess I listened to a lot of audio files, right? And then you must be wondering, well, what's that big file, right? That's pictures. So that's the iTunes folder of pictures, right? That's where if I wanted to free up disk space, I should delete these right first, right? Maybe. So that's a real example of a tree map. And there is actually a reason I'm talking about tree maps. I just thought it would be good to give the background before jumping into what we're doing here in the computer science department. So some of the nice properties about tree maps, they fill the space, so they make efficient use of space, right? They expand the data mapping to use your whole screen space. They represent hierarchies. They can be used for multivariate data, which is what you all have in healthcare. And they can handle big data sets because they're hierarchical. You can drill up and down the hierarchy interactively. There's no geospace encoded though, so I can't tell where things are happening. If there's some relationship to the real world, like people somewhere in Wales, for example, I can't tell anything about the geospace. And there's no neighborhood preservation. That means I can't tell who my neighbors are in the real world, so to speak. And then we have question?
Tree map is iterative.
Iterative. Yes, you could say it's recursive. So any node inside the tree can be subdivided further. Yep. How about cartograms? Anybody heard of cartograms before? Yeah, raise your hand if you've heard of cartograms. A highly educated audience. It's a special audience. Anybody not heard of cartograms? Raise your hand if you've never heard of cartograms. They're not as popular as I thought they are. They're kind of popular. Probably most people have seen a cartogram, but they didn't see the word cartogram associated with that image. So here's our favorite island, right? And it's been subdivided into different regions. In a minute, we're going to talk about CCG regions. And then some variant has been mapped to color in those regions. Right? Very, very standard. It's called a choropleth. Right? Very standard kind of visualization, actually. But look what's going on. London has all these different regions, sub-regions or sub-areas, and they're all scrunched together, so I can't see what's going on in London, right? I might have the same problem in Cardiff, and I'm going to have the same problem in all densely populated areas, right? So what a cartogram does is it replaces each of these geographical areas with some sort of shape, right? In this case, it's a circle. And then the radius of the circle changes depending on the variant that you're interested in seeing. A typical example is the population, right? How many people live inside this area, right? And look at what happened to London. London got exploded, right? Because all the people are living over there. And it looks like Cardiff got some things. But this is not necessarily population, actually. I don't actually know what this example really is. But those are the consequences of using cartograms, right? More simple to understand, I would say, than tree maps, right? There's not that much in terms of interpretation to say. Cartogram properties, so they're great. Cartograms are great. They include the geospace, right? That's a great thing. They're very engaging. People love to look at cartograms. They love them. And they are engaging. I like to look at them too. Right? When you see things on a map, you want to look. I don't know what it is. They have a magnetism about them. They also have been shown to increase memorability. So anytime you plot data on a map, it becomes more memorable, right, as opposed to no map. However, they're not necessarily space efficient. So has anybody here ever tried to print out a map of the UK? Or bought a paper, old-fashioned paper map of the UK? It doesn't fit. It doesn't fit on a piece of paper very well. You end up with this long piece of paper and then this sort of thin strip in the middle almost. And actually, it's only about 20% of the paper is dedicated to the UK. The rest is water. Right? So it's not space. The UK is not space efficient, unfortunately. Right? They're usually univariate, so they usually map to one variable, which is not really. It's very useful, but maybe it could be better. There's, of course, error in this geospatial error, so they rely on distorting the map. And they're generally not hierarchical. Right? That's the standard cartogram. Right? So I'm sure everybody's now very curious, what's going to happen next? I cannot believe it's too exciting. The suspense is agonizing. So can we combine the two? Can we get the properties of both? That is the question. And finally, I've always been wanting to work on healthcare data, and it took me a long time to get around to it, but we finally got around to it, and we are working on this. This is work in progress. And this is one of our first attempts, right, at looking at this problem to try to combine the properties of tree maps and cartograms for healthcare data, right? So we want to come up with a visual design that includes the geospace, that's space efficient, that can handle multivariate data, it can handle hierarchical data, and be engaging all at the same time, right? And this is a preview of what we call the cartographic tree map. Now, what is the data we're looking at? Anybody checked out the Public Health England's data yet? I guess you're all obsessed with the SAIL database. That's fine. That's fine. Nothing wrong with that. But there are other data sets, and this one's public, so it's very convenient. But it also happens to be extraordinarily challenging, this data set. Right? It's huge. So the UK is divided up into clinical commissioning groups. I think everybody here knows that. Right? And each of those clinical commissioning groups has NHS services inside, right, that belong to their group. And they collect diagnostic information about every single person in the CCG. Right? So if somebody visits a doctor and they're diagnosed with cancer, that diagnosis is recorded in a database and it's released to the public, right? Not at the individual level, but at the group level, right? So we can get prevalence indicators of lots of different diagnoses all across the UK, right? And they've put the data set, it's huge and it's complicated, on a website, Public Health England website, and that's what it looks like. And they've said, why don't you try to visualize that, and they've released it. And this is a typical example of plotting two variates, right? This one happens to be cancer, right? And it's a scatter plot, right? But there's no geospace, right? In all the examples that they're showing, there's no geospace. It's nice to know where things are happening, like where is the highest cancer rate, for example. So the question is, can we couple this to geospace? So this is the data we're looking at, right? In the example we're about to go into. Here's another sort of preview. This is a map of the 209 clinical commissioning groups, so mapped on a standard UK map, right? Here's a bunch in London. Good luck trying to figure out what's going on there, right? I hate to break this news, but Wales is not included in the data set. And I don't know what the explanation for that is. Scotland is also not included, right? And this is not the health data, by the way. This is just another example of a cartogram. But here's an example of trying to map data to a multivariate cartogram, right? Every area has been broken up into a hexagon, and then there are layers here, 4 layers. So it's an interesting attempt at trying to visualize multivariate cartographic data, right? And that's what an attempt could look like. So we're going to look at cartographic tree maps. We're going to give a demonstration of this software we've been working on. So each one of these rectangles represents a clinical commissioning group. And inside each clinical commissioning group is a small tree map. And the rectangles are mapped to prevalence values. So in this case, it's coronary heart disease, heart failure, right, and so on. Let's see, I can't read the third one. The stroke. Yes, thank you very much. Chronic kidney disease, diabetes, all our favorite things. Hypertension, right, cardiovascular disease, and so on. So there are 14 different asthma. There are 14 different diagnoses or prevalence values here. And if you click on any of the rectangles, you get a close-up view, so to speak. So you can find out the details. You can find out the exact prevalence values, exactly which CCG it is, and so on. So you can get down to the original data. And let's have a look at that in action. So this is an interactive piece of software. It's not a static. Piece of software. This is a demo of that software. So one of the properties we wanted to include in the software is this trade-off between the amount of space we occupy and the amount of geospatial error we introduce. And that's what the user is doing now. They're adjusting this trade-off. So the bigger the CCGs are, the easier it is to see the data. But then the more geospatial error that gets introduced, right? So we actually give the user explicit control over how much error they want to see versus how much space they want to.
Got 14 categories in 7 colors, or are they different?
That's a very good question, actually. I was hoping nobody would ask that. He said there are 14 variants and only 7 colors. That's correct. We're going to see some other examples, by the way. So we have been working on that. The initial focus wasn't the color mapping. We just sort of chose one and said, let's live with it, and then look at more detail about the color map later. Right, but we have, in the second demo, we have a better color map, right? In the first demo, it's not so great. So in this case, all the CCGs are uniform size, so they're easy to compare, right? But we can also set their size to be proportional to the population that CCG is serving, so to speak, the number of people being served by the CCG. One of the interesting things that pops up, though, is the biggest CCG is actually in Cornwall, which is kind of, in my opinion, that's a surprise. Some people that might not be a surprise, but for me it was a surprise. For me, it sort of indicates that the budget for that CCG is the lowest, right? It's like a set amount of money for the most people. These are all different algorithm parameters. So when the user hits the start button, it runs the layout algorithm. So it starts with the centers of the CCGs, and then it expands the areas in an animated fashion until the layout is complete. Right? And this is grouping CCGs together into groups so that it looks more like a traditional tree map. Right? And then it occupies the space a little bit more efficiently. Right? This is the user looking at the actual error involved in the layout algorithm. So the layout algorithm has some geospatial error, and we can quantify the geospatial error, and we can actually look at it, right? What we want to ensure is that neighbors are preserved. So if there's a neighbor on the south, it's always on the south, right? And if there's a neighbor to the east, it's always to the east of its original neighbor. We don't want to change the northwest, the longitudinal and latitudinal information. And you can see like there's some special handling at the boundaries, so some CCGs get really pushed in a very distorted way at the boundaries in the north and the south. And this is quantifying the error. That's probably not so interesting for this audience, but it's possible to quantify it and measure it as a percentage. And if you want to know exactly how much geospatial error you're introducing. And what we call an error is when two neighbors cross, right? If they cross their position, then we call that an error, right? And that a line connecting two neighbors means that they crossed each other. So the north-south relationship changed in that case. And usually the neighbors that are very far apart, they're the ones that get distorted from each other. So that's mapping the CCGs to a variate to the size, right? We can also adjust the maximum size, right? That's again the trade-off. Here's the user experimenting with different color maps. So color mapping is an option, right? Different color mapping options. They get a little bit better in the second demo, the color mapping options.
The thing is that with the Colormap, the biggest area will dominate, and then with one tube you can see if it's hypertension. If you have two colors on the same thing, I don't know if it's hypertension on the other one.
Yes, yes.
It seems to be hypertension, by the way.
Yes, so that's a good observation. So one of the things that jumps out immediately is, oh, hypertension is the most commonly diagnosed indicator in the UK. So that's something that jumps out right away. Guess what? The second most is diabetes. So it becomes things like that become very obvious. Now, if I could practice a psychic exercise, which I like to do, I'm going to read your mind for a second, and I think what you wanted to ask is, or say is, wow, there's so much information on there. Is there a way to reduce it and simplify it?
I wasn't, but let's go with that.
Okay, my psychic powers, sometimes they work, sometimes they don't. Usually they work.
Start with visualization.
I can read palms too. But we're going to get to how you select subsets. Okay, this is a way to select subsets. This is an option that just says, show me all the below average values. So these are all the below average values. The one before that said, show me all the prevalence values that are above average. And that's a way just to immediately see less information and focus on what you might be interested in. So that's show me everything. And now we can select individual variants to focus on, right? We can turn them on, we can turn them off, and then the user can interactively choose which variant to focus on in the software, right? This is called a focus and context visualization. This gray is the context, and the colored region is the focus, right? So we can get the overview still, but we can focus on certain variants. Right? And that's the user having a look at the higher values. Right? And we can make a few observations that Hypertension, for example, is the most prevalent health disorder, right, with the largest proportion, and the second largest is diabetes. Those are just two that are very obvious immediately. We can single out Bradford as the distinctive highest diabetes, right? And we can look for the highest chronic kidney disease without too much trouble at Islington, luckily with the highest mental health disorder.
Could you,
Right.
could you separate area by area? So if you wanted to compare, I don't know, say like the southwest and the southeast, you could separate that?
Definitely, yes, you can separate by area. You can click on any area interactively and then get the detail, right? That's what those big windows that are popping up are, the user clicking on an individual region and then the details. So for example, London is generally healthier except for mental health and diabetes. So all the other values are below average, but mental health and diabetes are above average compared to the UK as a whole. Right? That's a nice multivariate observation you can make with these cartographic tree maps, right? And we can sort of see that the northwest regions, generally, the health is going down on a global perspective. If we look at these 14 variants all together, right?
The problem is you use duplication of a set of colors. They look very whatsoever.
Yep.
I think you put some dot at the second set.
Yes. I can see this audience likes color. That's good. I love color too. I really love it. And we're going to improve the color on the second demo. But one psychic reading I'm not picking up. It's like, or am I? I'm not sure. I think there's somebody in this room thinking about time. Somebody thinking about time? Like, what time are we looking at? Yeah, I was picking it up. I knew I was picking up something. So color is awesome. And then there is time, right? We were looking at a single year. I think it was 2011, I'm not exactly sure. The other question is, what about time? Can we incorporate time-dependent data in there? And there's our favorite color mapping again. It gets better though. You'll see an improved color map, I promise. So this is our initial attempts to encode some temporal information in there. So for example, what happens year after year to the UK health? The most naive approach is to just use bar charts to replace each individual bar with a bar that represents each year, each variant. And we'll see what happens when we do that. This is a close-up. So each segment here represents a year, right? That's the first year, the second year, and the third year. I think it's 2012, 13, and 14, or something like this. And in this particular design, it's increasing. This is focusing on the increase. So this problem, this diagnosis, so diabetes is increasing in Northumberland, right, over these 3 years. And it's increasing. You can sort of see already, lots of increasing diabetes all over the place, actually. That's one of the things you can see immediately, right? So let's watch that demo with the improved color maps that I know everybody loves. So this is the attempt to incorporate time into these. So we start out with the most naive possibility, which is just a bar chart inside of each CCG, and that's what it looks like. These are actually bars, right? But it's hard to see the differences between the bars, right? The amount of change relative to the total is quite small. So the question is, how can we improve that? We tried an experiment where we shrink both sides of the bars, the tops and the bottoms, to exaggerate the effect or to make it more visible. And then we tried a variation where we focus on only the differences. We take out the constant and we focus on only the gradients. So it's only gradient information that we're talking about. So they increase over time or decrease, and we cut out the constant, so to speak. And it exaggerates the differences, right? It's like turning on an amplifier, and it exaggerates the differences so we can see the increasing and decreasing trends more clearly. Right? And that's what we're seeing. Those are the symmetric bar charts, so to speak, and then we saw some other variants. And then we can, again, focus on increasing only. So that's the user saying, show me all the increasing prognoses only, and then leave out the decreasing ones. Right? So we see, for example, that most of the values are increasing. The majority of the values are increasing across all health challenges. Right? Those are the three different variations. Right? There's the standard bar chart, the symmetric bar chart, and the other bar chart. This is the user saying, show me all the decreasing prevalence and indicators across the UK. So we can see a group here where hypertension, for example, is decreasing in the south. Right? And we can also see chronic heart disease, or coronary heart disease rather, decreasing in a lot of different areas. But it's mostly white space, which means most of the values are increasing over time, over these 3 years. Which is interesting. That in itself is interesting. At least for me it is. Right? So the collective health of the UK is decreasing. It's getting worse, at least according to this data in these 3 years. These 3 years. We experimented with animation. So just to animate the increasing and decreasing trends. So if it's moving to the right, it means increasing. If it's moving to the left, it means it's an indicator of a decreasing value. To give it some more sort of, I don't know, a lively effect, so to speak. It's quite difficult to see what's happening though with just this animation. So it makes sense to also focus on either change only or subsets, particular variants that you want to look at the same time. Does anybody like this improved, the color maps? This is not the best example of a color map either, but there was a good color map that I can rewind and let's see the good color map again. Okay, that's a better color map for the color people. So those are 14 different colors. It's still not that easy though, even with the 14 different ones, because some of the colors are very close, right? These purples.
Bob, I've got a non-colour question. If you've got 14 categories of illnesses and they're in the rectangle, and each space is proportionate for all the different categories. If one disease decreases by 10%, doesn't the rest of them automatically increase by the space that's left? And therefore, the increases.
It shouldn't happen that way. It should, at least when you hit increase only, you should only see the increasing values.
Well, but on the original, just the rectangle or the square, whatever it is, if you've got 100%, whatever the terminology is, you take 5% from one category, everything else by default increases by 0.5%.
So it will take it will take the sum over all the years together, right? And it will use that to compute the original rectangle. So the sum of all the years together. So if there's a decrease, it doesn't matter because that's represented by the gap, the new empty space that arises inside the rectangle. So I hope that made sense. So those decreases show up as white spaces. That's what happens. The whole rectangle doesn't shrink. The tree map rectangle stays the same size, but the bars change their size. Does that make sense? Now, if I looked at, you're right though, if I looked at only a single year and I put like two next to each other, then it would be a little bit misleading. Yes, yes. But if we look at the time, use the time-oriented version that computes the total over all years, then it should be okay.
And is the data age standardized as well?
Excuse me?
Is the data age standardized for different regions, for different CCGs?
What do you mean,
So
standardized?
So if one region is got a very old population, one's got a very young population, yeah, cool. You need to adjust the underlying data.
We didn't do any standardization in that aspect. I can say that the data is divided into different age groups. So it's like every 3 or 4 years, so 0 to 3, 3 to 6, 6 to 9. And so everybody falls into one of those categories. All we did was we just added them all up. We got rid of the distributions. And we also got rid of the gender. So the gender's not showing here either. And there's also we didn't use, this is a simplification of the original. And we also don't include the confidence intervals. There are confidence intervals in there, and we don't look at that either. But it's all good future work. Right? It would be nice just to see the options of like male, female, for example, or like you mentioned, a certain age group. This is using line charts, so the same idea, but putting in a line chart inside of each CCG, and each line represents one of the variates. This is an obvious attempt, by the way, and each column in the line chart represents a year. And this is showing the change only, or the gradient only. The line charts are not as exciting as we thought they were going to be. We thought, oh, this is going to be really useful, but they're not as engaging as we thought they were going to be, actually. This, I think, is another color mapping with 14 different colors. I think this is the best one that we came up with so far, this color map. Right? It's 14 distinguishable colors. Right? So that's one of the user options in the color mapping drop box. There's a drop selection. Is anybody unhappy with this color map?
It's a bit brown.
It's a bit what?
Brown.
It's a bit brown, yeah.
It's a bit drab.
Drab? It's not very exciting. Like that. If anybody here wants to propose like a better one, I'm all ears.
Some pattern with some color which is quite similar. Like
They
for
are-
me,
they
the
are-
mental health is quite similar, cancer is quite similar.
They are similar, but they are also distinguishable as well.
But when you plug into electronic versions, the distinction is not so clear.
It's not 100% clear, no. I'm not going to say it's like the perfect color map or anything like that. I would say this is our best version that we discovered so far for 14 variants. And at least it is distinguishable. However, having said that, we also have to rely on the ordering. So the ordering is the same. So we have to rely on our knowledge that the top left rectangle is coronary heart disease, and then the second rectangle is heart failure, and so on. Right, that's, we have to use that information, otherwise we're gonna get lost.
Can I ask why?
Yep.
Why we have so many conditions on the graph?
I think-
Most of the time, I'd probably be filtering those out.
Yes, that was an arbitrary choice. I think I just thought, oh, let's include as many as we can and see how far we can go. This is the user filtering out or turning off some of them, right? And you can crank it down to just one if you want. And you can so the tree map, look, the tree map updated, and now it lays out only those ones that you chose.
I think you start to see the geography of it then.
Yes. So it's funny because you're going forward with the multivariate, but then you're rewinding back to the univariate in some ways. So yeah, we
It's nice to be multivariate, but,
Yes,
but not
yes.
necessarily.
yes. So we have options that turn them on and off. Okay. Any other questions?
Thank you very much.
Comments?
Thank you very much, Noel. Any more questions over about those that you've already addressed?
I like the enthusiasm. I like it.
Yeah.
It's good. It's not
We're all
nearly.
questioned out though, that's the trouble.
No, I can feel. I'm getting a reading. I'm getting a reading. There's another question. I can feel it. I'm getting signals. Nobody's gonna ask. I can pick it up. You don't even have to ask. I can pick up some of the questions. So one of the questions that I'm picking up is, oh, can we watch those videos like, at our own leisure? Right? Or can I get those videos, or can I see those, or something like that? The answer is no! The answer is yes, you can see them on YouTube. So there's a copy of those demo videos on YouTube. And yeah, they get like, I don't know, something like 10 billion hits every second.
So every time I do some kind of complex graphic, it tends to be once only. Because next project is just slightly different. It's slightly different again. So if I came to you and said, oh, I want the change in prevalence, but it has to be this metric. How quickly can the new metric of prevalence be incorporated into a sort of how flexible are we to updating this kind of thing?
I guess it depends on how much it varies from the sort of the public health England. Like if it's based on CCGs, then it's very easy to make changes. Right? If it's based on the same CCG map, then it's no problem. But if it's based on a different map, like a different geospace, then it's going to get a little bit more complicated. But the principle should apply to any set of any map, right? Principles here shouldn't matter. Right? We just happen to choose the UK one because the health data set is sitting there, and yeah, should work. Another question?
Just a note, when you're putting so many elements on the map,
Yep.
they're all, especially the ones that we're scrolling, they're all competing for our attention. So you just see a sea of moving things.
Yes.
So if you wanted to show, maybe you can accelerate those that have higher changes, for example. Then you see some elements are moving quickly, some elements are moving less quickly.
Yeah.
So then you see patterns. Then you see something that grabs your attention.
Yes. It's interesting because we're showing too much information in some ways. Yes, but yes. So in this software, the user could choose the number of variates they want, and then they could select like, show me the increasing values only, and turn on an animation, and then just see a few that are moving instead of lots and lots of rectangles all moving. Yeah, I agree totally that turning them all on and just saying animate yourselves is too much. It's like it's not very effective. Animation in general is very challenging for just cognition. Just all animation is cognitively very, very challenging. However, on the counter side of that, it's also very engaging. Like when things start to move, then people get more engaged in some ways. And you do need motion in software. Like if you press a button in software, you need to see an animated transition. If you don't, and then you blink by accident, and things have just changed without any transition, then it's also something that is not cognitively.
Do you have any plans of incorporating VR?
Do we have any plans on incorporating VR? No, I don't think we do, but if you know anybody that would be interested, we're happy.
As a way of increasing the space.
Yeah.
Put things like
A power wall would be another option, right, to increase the space.
What's that saying? Power?
A power wall, right, one of those walls with a whole matrix of monitors that are all synchronized and coordinated. Another question?
Have you explored the governance issues about doing this visualization within the sale data bank, the DP practices we have?
No, I would love to do that though. That would be great to apply this type of thing to Wales and the sale data bank. But I haven't gotten into. From what I understand, you have to be blindfolded and handcuffed and locked in a raffle or a jail cell to access the.
Is that the old arrangement?
I forgot to bring my blindfold and handcuffs. Or a bag. You have to put a bag over your head. Duct tape over your mouth.
You're alright in this building, so you want to try and get into our data science building.
Yeah, but that would be really great.
Thank you.
Any question?
Thank you for a fascinating talk. Really enjoyed it. So I wanted to ask if you've got any artists involved in sort of looking at the sort of the visualization in terms of interpretation by humans kind of thing. Have you got anybody involved in your list of
So you mean to help with the visual designs and the original visual designs?
just looking at
Call
not
that technology.
just kind, it's also the way human beings look at information, take information. They probably have a better understanding of what works and concepts. and things like that.
Yes. I would say that is future work. But we do have Damon. I don't know if he counts.
As an artist.
But you.
Didn't look on that. Thank you.
But you're right, though. It is a little. It's a little bit computer scientist centric. It really is kind of this idea is really based on computer scientists. I happen to know, but I do know that people love cartograms. I do know that. Like if you pick up any, like the New York Times and stuff like that, you find cartograms. People open the magazines and they love those. So I do know that. I don't need a user study to find that out. Tree maps are also more and more popular with time. So I know that. So at least we had some intuition that something like this could be interesting. But
Just
you're
going
right,
back to the
though.
colour schemes.
Yeah.
I remember you showed us any number of different colour schemes.
Yep.
And there was
Yep.
one colour scheme that I thought worked quite well.
Mhm.
Not sure whether you showed
Was it the first?
those?
I think it was the first demo showed those different
Right.
color schemes.
Well, there was one particular colour scheme which highlighted something happening up north.
Yeah.
Do you remember?
Was it a
Which-
color or was it a filter? Because
No, I think it was a whole colour scheme that
Okay, let me see if I can find the color, the user changing those colors.
I didn't recognise it from any of those.
There's the colors.
No.
There are the colors being changed. So there's there's the user selecting different colors. Is it one of those you're thinking of? color filter. No?
Nothing standing out from any of those. Anyway, yeah,
Okay.
that's probably just me.
Because there's the user turning on like above average.
Right.
So this is show me all those prevalence values.
I'm sure it was a full set.
Okay.
We were looking at, and something jumped out at me in the north.
Okay.
Anyway, yeah. Not to worry. Oh, question.
So everyone wants to go, but so you were using a tree map because you can model hierarchical data, but actually those diseases aren't hierarchical at all.
Yes.
So have you looked at using a different data structure within the cartogram, like a pie chart?
Yeah. Well, we use the tree map not necessarily because it's hierarchical. Actually, we like the tree map because it's space filling and space efficient. So it spreads the data onto the screen space effectively. It wasn't the hierarchical, and that you're correct though. The hierarchy is neglected a little bit in this. It's sort of a side job or whatever. It's not the focus, the hierarchical aspect. Yeah, it's more like future work. There was only one part that we really grouped a bunch of CCGs together and said, here's what it looks like with another level in the hierarchy. And that's definitely, there are definitely possibilities there to add levels to the hierarchy. For example, adding the gender as the next level down the hierarchy, or adding the different age groups as the next level down in the hierarchy. That would be great to explore. We could also add the individual NHS practices to the next in the level of the hierarchy. Now, your question with the pie charts, we did think about that, but I just thought, well, we're not done. You know, this is like we're never finished. But at that time, I just thought, let's try to get the most space efficient representation we can, and if we use circles, then we get the gaps between the circles, right? So it's not as space-filling circles.
You square a circle, square a pie chart.
Well, maybe this is sort of, this is sort of a squarified pie chart. You know, it's not using slices. There is a paper that does that, though. There's a paper that does a tree map layout that resembles things like pie charts and bar charts and so on. Yeah, so that's been done already.
Hexagons that somebody was using.
Yeah.
Earlier on. Right.
Very enthusiastic.
Oh, yeah. No stopping though.
Thank you.
Right. Well, let's thank Bob once again.
So just a quick word about the next seminar, which is on the 15th of November, and it's Jeff Rogers of Explicit, and she's going to be talking about the register and